Hello?
Hello?
What's going on, baby?
Yeah, I'm in the hospital.
What? In the hospital? What's going on?
They said it's my appendix. I don't know what else.
With your appendix? You've got to be kidding me, James.
Well, they talking about I gotta have a shit. I just need you to come up here. I'm in a lot of pain, and I don't know what I'm gonna do about how to pay it off or whatever.
Well, what are they saying,
No,
sweetie?
they're just asking like, how am I gonna do? I have any like form of payment or anything like that? And I don't know what to tell them. So,
All right, baby. I'm gonna be up there shortly. I'm getting up now. I'll be right on out there.
all right, bye.
With youth comes a certain sense of invincibility. Most young adults under 30 have yet to face chronic disease or disability. While many of them appreciate the safety net that health insurance provides, it is often priced higher than they can afford, meaning school, food, and rent may take priority over the possible need for prescriptions and doctor visits. They take the chance that they will remain healthy. For many young people, healthcare is just too expensive, says Julius Hobson, a senior policy advisor at Bryan Cave LLP and previous director for Division of Congressional Affairs for the American Medical Association. Either they don't have access through their employer or they can't afford it. In many instances, the attitude is, I'm not sick, so I don't need it. They don't think it's a problem until they get ill. When illness or injury does occur, even the healthiest of young adults have to turn to medical professionals for help. When young adults become ill, they show up where the care is most expensive, and that's in the emergency room. A lot of times, they're not doing regular checkups. Then, when they have a health problem, they go to the emergency room, and that is where care costs the most. A survey from the Commonwealth Fund estimated that there are approximately 13.2 million uninsured young adults in the United States. While this age bracket only accounts for 18% of the population, it comprises nearly 28% of the country's 47 million uninsured. With the current recession, the number of uninsured is expected to grow. A report in Health Affairs notes that the increasing unemployment rate, coupled with the rising cost of insurance, could elevate the total number of uninsured Americans to 52 million. Many young adults go without insurance because they fall into one of several gaps in the current healthcare system. Many young adults go without insurance because they fall into one of several gaps in the current healthcare system. Most insurance policies terminate coverage for dependents at age 19 or upon their completion of college. Without their parents' insurance, young adults are left to find their own coverage. Over half of young adults have incomes 200% below the federal poverty level, according to the Urban Institute report. Yet only 13% of them are eligible for Medicaid or other public programs that provide medical coverage. Whether coverage was terminated under a dependent plan or health benefits were not offered through an employer, young adults face a number of obstacles in obtaining medical coverage as the number of uninsured continues to grow. In response to the growing number of uninsured, especially those under 30, President Obama has made insurance coverage a central focus of healthcare reform plans and has urged Congress to take immediate action to address reform. This is an issue that affects the health and financial well-being of every single American and the stability of our entire economy, Obama said in a weekly address. It's about every family unable to keep up with soaring out-of-pocket costs and premiums rising 3 times faster than wages. Every worker is afraid of losing health insurance if they lose their job or change jobs. Everyone is worried that they may not be able to get insurance or change insurance if someone in their family has a pre-existing condition. As the Senate and House of Representatives continue to look over proposals for health care and insurance reform, young people should check with their state to see if an increase in the age of dependency coverage has been put in place. According to the National Conference of State Legislatures, at least 30 states have enacted legislation that extends the age of dependent coverage, regardless of enrollment in school. And many states have enacted provisions to extend the age of eligibility to 25 or 26, with some states, including Florida and New Jersey, which allow individuals up to the age of 30 to remain on health insurance plans as dependents. For many young people, health insurance is more than they can afford. Here are a few of the statistics on the young and uninsured in the United States. People in their 20s make up 29% of the uninsured in America. 1 in 3 adults aged 19 through 26 are uninsured. Only 13% of uninsured young adults are eligible for Medicaid. Approximately 28% of the young uninsured has the option of employer-sponsored insurance. 48% of uninsured young adults believe they need coverage. So, here we are with James when life was simpler. We were a 2-income family with health insurance. James made his required doctor's visits. He was always up to date with his immunizations. His dad and I probably had no idea then how precious that was, going to the doctor and pulling out the insurance card. We had health care options. We picked and chose whose employer offered the best coverage. Wow. Time progressed and we progressed to some degree. Changes were made. Children were added and they grew up. Then the family became a single-parent income household. It appeared to be okay because our basic needs were being taken care of and we still had health care coverage. Well, changes continued to happen. James turned 18. This was fine for a while. All while I was employed, he continued to have health care again while I was employed. My position was eliminated in June of 2010. My initial intent was to pick up the COBRA insurance, which would have kept our health care coverage the same. This was my intent until I saw the cost. I simply could not afford to insure my family in this way. I applied for a medical card which would cover myself and my then 15 and 12-year-olds. What was I supposed to do for my 18-year-old college student? Public Aid said he would have to apply it for himself, to which he was denied. As life would have it, a little over a month ago, James, who attends college in Joliet, Illinois, was in severe pain and went to the nearest hospital. It was the more expensive one in Joliet. He didn't even know enough to think if this was the right thing to do. All of his life, he's been able to go to the doctor or emergency room if necessary. He ended up needing an emergency appendectomy. We are anxious to receive the bill as well as an approval or denial to the second request for public assistance, which the social worker at the hospital assisted him with filling out again. So, in an ideal situation that would have us back here without the worries of healthcare, we would like to live in a country where the healthcare model was similar to Japan. Japan offers social insurance. Everyone is covered, not by taxes or through taxes, but everyone signs up either at work or through a community-based carrier. If you lose your job, you cannot be turned down for coverage. The government picks up the costs for the poor. The costs of services are controlled by the government, and it is affordable. This would be ideal for young adults that cannot afford quality health care. I believe the United States has a responsibility to its young adults as they transition from childhood to adulthood. Let's see what our United States government will say and do about it.
Louder.